हेलो माय डियर फ्रेंड्स। आप सभी का बहुत बहुत स्वागत है। वेलकम यू ऑल इन दिस पीएसएम सेशन। टुडे वी आर गोइंग टू स्टार्ट द इंट्रोडक्शन जर्नी टू पीएसएम। हम सभी ये जानेंगे कि प्रिवेंटिव सोशल मेडिसिन क्या सही में एक इम्पोर्टेंट ब्रांच है या एक इम्पॉर्टेंट ब्रांच है, और इसे कैसे पढ़ें, इसे कैसे आसान बनाएं, और आपका पीएसएम में क्या-क्या टॉपिक आते हैं, व्हाट आर द वेरियस एरियाज व्हिच वी कवर, व्हाई वी रीड पीएसएम, these all are we are going to discuss today. Plus, if you have any doubt how to study PSM, what books you should follow, how to make it simple, how to memorize it easily, or if any area you want to study, or if you have any doubt or question, you can ask it in our chat box also. So first thing is ki this preventive social medicine, which is known as community medicine in some part, what are the things which we study in it? So the first thing which we study in PSM or community medicine is about the reality of India, the health system of India, how our health system function, how it is better in some states, and how we can make it much better. क्या हेल्थ सिस्टम में कमियां हैं, क्या इसमें कुछ राज्यों में खूबियां हैं जो बाकी राज्य कॉपी कर सकते हैं या उसको सीख सकते हैं, और हम अपने हेल्थ सिस्टम को कैसे बेहतर बना सकते हैं. सो दिस इज वेरी इमोशनल टॉपिक रिलेटेड टू एवरी वन ऑफ आवर लाइफ, एंड it is something which can help you in doing very good in our in your field posting also. It can help you in changing the picture of India also. And you might be thinking ki okay, these all are topic of PSM, why the teacher is saying that it affect our life. So let me give you a personal story which will make you understand how important is health system of India. See, when I joined MBBS in Aligarh Muslim University in 2006, at that time my father was having hypertension and diabetes due to some stress because the factory has been closed. That was a government factory, and at that time the government decided to close it, thinking it's not giving too much profit, or thinking that we can invest that money in some other work. So when the factory got closed again due to government decision, then my father developed stress, and with his stress he developed hypertension and diabetes. And because the government health system do not provide good quality medicines to the people uh, for a very long time, so what happened is all the middle class people, when they suffer from any financial stress, they cut the money from their own treatment. And that's what my father did. He, because of the financial struggle, he stopped taking his medicines regularly without telling it to other people, without telling it to us. And then he developed from लेफ्ट साइडेड हेमीपैरासिस एंड वीकनेस. तो उस दिन मैं घर पे ही था. पहले उनकी दिक्कत ये होनी शुरू हुई कि उन्होंने मुझे बताया कि राजू, चप्पल पहन रहा हूं और वो चप्पल स्लिप कर जा रही, और जब वो बोल रहे थे तो उनकी आवाज क्लियर नहीं आ रही थी. जब आप आगे जाओगे तो आप पढ़ोगे कि लेफ्ट साइडेड हेमीपैरासिस में द स्लीपर स्टार्ट गेटिंग लूज बिकॉज आवर लेग डू नॉट हैव प्रॉपर मोटर control. Plus, why the language is getting not so clear? Because due to 12th nerve paralysis, paralysis, not paralysis, this hypoglossal nerve which control our tongue, this speaking also becomes slurring and not so clear. So I was in second year, but still I can sense that something is wrong, but I was not able to make the diagnosis. Then we took him to a government hospital because our financial condition was not so good. It was Indira Gandhi Institute of Medical Science, IGMS Patna, and at that time IGMS Patna was a very less developed hospital. So we were in the capital city of Bihar, but still the nearby health facility, when we went there, there were no specialists in evening time, and they asked us to go through CT scan, which show that there is a ischemic infarct. है ना, कि एक वेसल्स कैपिलरी में थ्रोम्बस अटक गया है, जिसके चलते बैसल गैंग्लिया में, राइट साइड की बैसल गैंग्लिया में एक लैकुनर इन्फाक्ट है. लैकुनर का मतलब होता है आइलैंड के जैसा, है ना. सो द सीटी स्कैन वाज सेइंग दैट देयर इज ए इस्चेमिक लैकुनर इन्फाक्ट ऑन राइट साइड बैसल गैंग्लिया, एंड इफ इट ऑकर देयर इज लेफ्ट साइडेड वीकनेस और हेमीपैरासिस. So there was an infarct, and we could diagnose it on CT scan. But because there was no expert and no intervention radiologist who can do give the medicine to dissolve that thrombus. Nowadays, at that time also there were streptolysin, another drug which can dissolve the thrombus if it is given within 6 to 9 hours of ischemic stroke. But that intervention was not possible because government facilities was not there in proper condition. And then by the morning when the doctors came on visit, they started mannitol, because mannitol, if you give on IV line, it lower the intracranial pressure. So they started mannitol and they started aspirin with clopidogrel so that no further thrombus can form. So they did their best after they came in the morning, but we lose that golden period where intervention can be done and his ischemic infarct can be dissolved. So you understood that I can say that uh, the health system of India is something which do not affect our life personally. But with my story, I hope you understood, बिकॉज गांव में शहरों में सरकारी दवाएं अच्छे लेवल की नहीं अवेलेबल होती हैं, तो जब कभी भी फाइनेंशियल प्रॉब्लम आता है तो फैमिली अपनी दवा कट कर रही है, बिकॉज द मेडिसिन ऑफ government is not available in rural area, peripheral area, and the cost is also not good. So whenever any family faces the financial burden, they cut their own medicine, which can pose them to risk of is this stroke and all. Because when they start medicine, all the receptor they suppress the BP. Suddenly when they stop medicine, BP shoots up and it can take any plaque of your capillary or vein, and those small fat plaque thrombus can go and deposit in the minor capillary of brain causing a stroke, or they can also deposit in the minor capillary of heart causing heart attack. So the point is कि when you take medicine for some time and then stop, then the chance of stroke is more. And that is why the stroke cases are there in large number in many villages. Also you will go, you will find 2 3 stroke cases definitely. It was not earlier days so common, but now it is becoming common because nowadays people start medicine, but because government health system is not reaching up to them, they stop it, and suddenly the BP becomes so high that it can deposit any thrombus of capillaries into our brain and heart, causing stroke or heart attack and death. So how health system can cause a stroke and heart attack, you can see that, and I have seen it in my own life. Second, when the government health system is not good, we cannot do the intervention in nights, and therefore the patient and their whole family suffer in the future. And I have seen again my own family suffering due to not giving good health facilities even in the government hospitals. So health system does affect our life, and we have to know that how we can make it better. What are the things which are available, what are the things which are not available, and how we can make them available, how we can make them better. So I wanted to make it personal so that you uh, try to understand that okay, this is related to our life, this is important. The second part in PSM which we have to know is how to earn crores of rupees, how to make our life filthy rich, and also at the same time how to help people. That part we learn in epidemiology. And one more thing I want to discuss with you, that you all saw this, that while I am talking about my father's stroke and other thing, I am not so serious. And actually, after suffering from 10 years, he died also, he is no more. But still, I am not so serious while talking about my father death. Why? Because I realized by being a father myself, all the parent, they mainly want only two things for us. First thing they want is that we should be healthy in our life. We should not suffer from drug addiction or major illness. That's why they try to make us fat also, so that if some illness come, our fat layer will absorb it. So they want all of their children to be healthy. And second thing they want for their children is to be happy. They are pressurizing you maybe to clear your exams and all, to study good, because they think after studying, after clearing exam, you will be happy. So their main target of any parent is just to see their child happy and healthy. है ना? If you are happy and healthy, they are happy and healthy too. If your health or happiness go disturbed, their happiness and health also get disturbed. And other than this, they do some idiotic thing. Like sometime what they do, sometime the parent compare you with nearby children or compare you with other sibling. But try to understand the reason of their comparison. They compare so that you feel the jealousy, you feel the competition, and you work hard. And when you work hard, then you will be happy in your life. That's why they are making saying those words. But don't focus on their word. Try to see their inner feeling, which is always to see you happy. And I have my kid Prisha Lakshmi, which is now 4 year old. Even if she fail in 10th time, and even if she become lesbian and all, it doesn't matters to me unless she is not happy or healthy. These two things should be good, then I will be happy. So um, always try to see their inner feeling. And anyway, my father was actually a very cool dad. I still remember when I was going to join MBBS, he asked me, son, when you will be in MBBS, will you date with other girl? And I said, yes, father, yes. So he said, okay, whenever you go on date, remember my three things. I said, tell me, father, I am writing first time you are talking something useful. He said, first, whenever you go on date, you will open the gate of the restaurant, of the car, wherever you are entering, you will open the gate, let the girl enter first, then you will go behind her. I said, okay, simple thing, I will do that. He said, second, whenever you go on date, first you will go behind the girl and pull her chair. Let her sit first, then you will go and sit on your chair. I said, okay, simple thing. Third, if the girl is not asking you to share the bill, you will not ask her to pay, you will pay the bill. I said कि बाबूजी आप ही का तो पैसा है, दो जितना देना है उड़ाओ, है ना, it's all your money, give as much as you want, I will not let any girl pay the bill, I will pay the bill. So I initially thought it is just three simple things, but even now some of my friends call and used to say कि the thing you used to do, the treatment you used to give, है ना, that we miss and no one else give. So he gave just three simple steps that how you can be the gentleman and you can treat the girl like a lady. And I thought it is simple, but it has mesmerizing effect on girls and all. And with this, I realized my father must also be a performer at his time. Because when I see the history of my parent, my father was from UP, mother is from a district near to West Bengal. I landed in between in Bihar. So he must have some experience of her own. So what I'm trying to say to you is that, let's say my father is not there and all, but still I can remember the good part of his life rather than remembering the bad moment, because bad moments are usually very small. Good memory are more. So we should always try to see the good memory. We should always try to see the inner feeling of our parent, and we should always try to see good in everyone, because everyone has good and bad thing. If you see the good in everyone, you will be happy, plus the people around you will be happy. This is the concept of positive deviance, and such concept we will learn in the topic of health planning and management. In this topic of health planning and management, you all will learn how to become a good manager. Because believe me, my friend, after 5 to 6 years, all of you will be in managerial position. Either you will be having your own private hospital which you are managing, or in government setup you will be working with team of doctor, nurses, health workers, and remember, nurses, health workers, they are with you, not under you. So you have to learn how to manage time, place, time, people, and money. So this all we learn in health planning and management. And remember, the best management strategy is positive deviance. Positive deviance means do not try to criticize people, do not try to find their fault, just try to see what is good in them, because there is something good in everyone, and try to appreciate them for their good thing. Because this is a universal rule, everyone in the world is hungry of appreciation. So if you will appreciate them for their good work, probably other will also try for appreciation and they all will evolve. तो मुझे अभी भी याद है, एक क्लास में ले रहा था किर्गिस्तान में, ISM में, वहां मैंने बच्चों को बोला कि आप लोग कभी अपने पेरेंट की बड़ाई करके देखिए, वो भी आपकी बड़ाई के भूखे हैं। फिर शाम में मैं, एक राजस्थानी बच्चों का टीम था, ग्रुप था, उन्होंने मुझे दाल बाटी चूरमा बढ़िया घी वी डाल के खिलाने के लिए बुलाया। तो उसमें से एक बच्चे ने बोला कि सर, जब से आपने बोला है कि पेरेंट की बड़ाई करनी है, मैं सोच ही रहा था दिन भर कि क्या बड़ाई करूंगा मैं अपने बाबूजी की। फिर मैंने सोचा कि जैसे मैं घर जाऊंगा इस बार अपने बाबूजी को पीठ पे हाथ ठोकूंगा और बोलूंगा, वाह वाह, क्या लौंडा पैदा किया तुमने। The only good appreciation he thought that he can give to his parent is कि wow dad, what a good son you have produced, है ना? So that may be also a good appreciation, but try to appreciate everyone around you, especially your parent, because everyone is hungry of appreciation, and if you will appreciate, you will find them to be happy around you, plus they will also appreciate you, and happiness of the world will increase in general. Okay, so this is health planning management. And I was about to tell you about epidemiology. What is this epidemiology? How it can make you filthy rich, a real multi-millionaire. See, EP actually means among, and demios means people, and logi means study. So any study done among people is epidemiology. Like right now, you are also part of a study. You just joined PW MedEd. Now they will compare your result after 2-3 years with other student result. And because they are comparing you in future, so that will be cohort study. And you will be compared in future with other group of students. So this is a study, but why I said it can make you filthy rich is, suppose you found a new medicine, a new drug, a new treatment. Now, if you presented your treatment in the form of a research, then only you can help crores of people. Otherwise, you can only help some thousands of people. And suppose you found a new drug and you made the patent for that drug. If you found a new drug or new treatment and you made it yours, you did the patent of that, with the help of, these new drugs or new treatment, you can actually earn billions of rupees. And you might be knowing stories of many pharma companies, many inventors who found new drug, new treatment, and then they made it patent, and then they earned billions of rupees through it, you know? And just last class, one girl asked me, sir, how we can do that new drug research. So one way is, you know, many plant extract which are useful in different treatment. Try to find out the chemical in that extract and use that chemical for treatment of your patient. Second thing is hit and trial method. You try treatment of some other disease on some other disease, and if the patient you found improving and you document it properly, then you can patent that this drug can be used here. And third method is that you can actually go into pharmacology and you can do your own research and find the new drug. So there are just three methods I am telling you, but there can be multiple methods by which you can find new drug, new vaccine, new treatment, and you can be known even after your death. And you can also earn billions of rupees and help billions of patients with the same new things. But unless you know epidemiology, unless you know how to present your thought in the form of a research, then you cannot get your drug patent, then you cannot prove anything to the world. So you have to know how to do research, how to do study among people. Okay, so when you do study among people, some data come out of it. And in biostat, we learn how to play with the data, you know? Because this is very important to talks in terms of data. Whenever someone talk in terms of data, people start believing the person. Like I hope you remember when Modi was about to come in power in 2014, he said, I will give 2 crore jobs, I will give 15 lakh in account, and people trusted him. Because when you talk in data, then people trust you more. So we have to know how to talk in terms of data. We have to know how to play with data so that we can use the data to prove good thing and also to get fund from the government to help poor people. Okay, so always these two things, epidemiology and biostats, are the very basic backbone of finding new drug and then getting filthy rich. And if you really want to help billions of people and get really rich, you should be interested in doing research, and you should be interested in how to use the data so that your research is uh, something which will be looking useful. Also with the help of data only we can analyze whether the new drug is useful or useless. So you have to know this biostat and epidemiology if you really want to do those invention and become rich and happy. Then, as I said, the third part is health system of India, in which we learn how to make our health system better and how it affect our life. Then the fourth part, as I was saying, is health planning and management we will read in PSM. The fifth part in PSM is definitely we will read about nutrition, which I overdid. So in nutrition, we will read about reference male, reference female, what are the indicators of protein quality, how much fat and all we should take. What do you mean by keto diet? How you can cause weight loss? Although I'm not a good person to talk about weight loss, but in nutrition, you will learn about all those prudent diet which we give to cardiovascular disease patient, high fat diet, which is keto diet and all. We will read about those in nutrition. So still, just for a glimpse, let me tell you the thing about high fat diet or keto diet. I always used to think this, that how come a high fat diet or a keto diet cause weight loss? Because this is high fat. So it should not cause weight loss. But the reason why it cause weight loss is because in high fat diet, the total calorie which we have to take in a day is 1000 kilocalorie. And if you look at a sedentary male and sedentary female, sedentary male means who is not doing any exercise or active work. So sedentary male should take minimum 2100 kilocalorie per day. And if it is sedentary female who is not doing any exercise or active work, she should take minimum 1700 kilocalorie per day. So the minimum energy which someone should take is 1700 and 2100. Okay, this is the minimum energy. And in high fat diet, the total energy is just 1000. So we are taking high fat, but total calorie is very less. That is causing the weight loss. Plus, in this total calorie of 1000 kilocalorie, fat should be 60%. 60% means 600 kilocalorie should be fat, and remaining should be protein and carb. So protein and carb, if you add together, then together they should make 400 kilocalorie. Okay, so actually I learned about this keto diet in a different way. If any one of you will go to Ayurvedic treatment center for treatment, which I did in Bangalore, I was free for one day Sunday. So I thought, let's go for Ayurvedic treatment center for my obesity. So they said, ki, sir, you will have to come regularly for next 14 days. In that 14 day, every morning, we will give you 1 katori of ghee, hot ghee, 1, 2 katori, 3 katori of hot ghee, which hot means warm, not very hot, which you have to drink. So I said, okay, I will drink it, but if I drink it, I will have too much of calorie in my body. How will I lose weight? They said, if you will take in the morning 2, 3 katori of ghee, then the whole day you will not feel hungry and your total calorie will be less than 1000. So I said, okay, I can do that, but I am here free only for one day. So they said, if you are free only for one day, we can only do one thing, your massage. Do you want massage? I said, massage for weight loss looks like a good option. I said, okay, I can go for it. So they said, go to upstairs. The room will be dark. Take out your cloth, wear the inner langot, small cloth, and get ready. We will send 2 for your massage. So I was like, okay, that looks like good thing. Went to the room, took out my cloth and all, and was lying on the bed waiting for 2 person to come. Suddenly the door was smacked like doom. And 2 big, tall, this muscular man entered into the room. My whole expectation crashed. And then they put over me some half liter of oil and started rubbing me sapa sup very badly. And in between they are asking, pressure okay, sir? I said, bro, whatever pressure you will put, that is always high. Never okay. So for 5-7 minutes, I tolerated their pressure okay, pressure okay. Then I was like getting too hot. So I requested them to leave me, please, chhod do mujhe. And I took down my pant, had some money in it. So I took that money, given it to them and said, please leave me. Your pressure is not okay. And that was the first and last time I went through such massage in Ayurvedic treatment center. So basically what I wanted to say is this keto diet is something which in Ayurveda also they are practicing, and in PSM also we have to learn. And to make this story interesting and stuck to your mind, I added that personal experience, so that if you will enjoy any movie of childhood, you till now remember it. Why you remember the movie of your childhood? Because first thing, you have good memory. If you remember movie of childhood, it means you have good memory, and that's why I say everyone has good memory. But why we do not able to read or remember the theory content of our book, which we have studied? Even yesterday we don't remember, but we can remember the movie which we watched 10 year back or 15 year back. Why this difference? Because that movie you were watching with interest, so you remembered it. And the theory which is being taught is taught in such a boring way that we don't develop interest, and because we are not interested, so it do not go in memory. And I have read 3 books on memory. Each book say the same thing, that memory is nothing but interest. The day you develop interest, your memory will be sharp. है ना? आपने भी वो सुना होगा कि ठुकरा के मेरा प्यार मेरा इंतकाम देखेगी, है ना भाई? If you will say no to my love, you will see my revenge. So when someone say no to you, that insult or that challenge develop your passion in study, and any peon can become IAS officer and any failure can become topper. So what does it mean? When someone do insult your insult, suddenly you develop interest, and interest can make you a topper. So that's why in all the teachings which we will do in PSM together, I will try to develop interest, because if you are interested in study, this boring PSM will also stuck in your mind for lifelong. Just like those childhood movie, this will also stuck in your mind. So this is one nutrition part, which, as I said, I did overdid. We will read other than nutrition the next part, and we will read all this session in such interesting way that you will never forget it. Because PSM is not just related with books and study, it is related with our life. All the things which happen in your life. You proposed a girl, acceptance or rejection, that also define many concept of PSM. Now, you are in a live-in relationship, or you are married, or you are just flirting with girls, everything is a concept of PSM. PSM is in every part of our life, and you will also feel that while being with me in this journey of PSM. So this is one thing which you have to read. The sixth part which we have to read is about our almighty nature, because Corona has made us all made this belief that we are nothing in front of nature. नेचर के सामने हमारी औकात डैश बराबर भी नहीं है. Nature can crush us any moment, any time, and no matter what is our position or wealth or something. So this COVID has made us feel the importance of water, air, sound, and the pollution, and how we can control it, how we can make it better. Other than environment, we also have to know that if you landed at a place as a specialist doctor, suppose you landed in a flood affected area, the army recruited you, requested you, and you decided, I will go and do help of the patient affected in flood. So how will you do the disaster management? How will you manage the flood affected area? How will you treat them? How do you decide to prevent the loose motion in those flood affected area in people? So all this disaster management we will read. Plus we will also read about how our genetics can be improved, how our communication can be improved, how we can communicate our feeling to people better, and how we can make the patient believe or how we can make the patient have faith in us, how we can be a good doctor which can uh, convince the patient that yes, you can trust on me. So the communication genetics part is also in PSM. Then in PSM we will also read about the biomedical waste and how to manage and dispose it properly. Then we read about the small cute little insects in PSM in entomology. We read about other than that, we read about the health of children, how to manage the pneumonia and diarrhea cases, how to manage pregnant ladies. Suppose you are traveling in a train or a bus and suddenly there was a delivery emergency. So how will you conduct delivery under emergency, and how will you help the mother during emergency? How will you help the old age people in their old age and all? So there's a lot of good part in PSM, and PSM I hope will make you the real full doctor It looks like preventive medicine, but it also have the treatment. It will, in the PSM part, we will read about malaria, the treatment of malaria, how we manage the cases of malaria, what the government is doing to manage malaria also we will read. Then we will read about TB also in detail. Then we will read about dengue managements and all. We will read about the management of all the common illnesses which occur in our surrounding, like JE, filariasis, hathi paw, hai na? So we will read not just the government part in it, we will also read if a patient come with malaria, how you will write the prescription, how will you manage the case. In fact, the next day class which we are starting with, our first class, is from these diseases and how we are trying to control these diseases. So first you will get the orientation of the disease, how PSM is helping you to control the disease, and how as a doctor you should write the prescription. So my aim is to make you a full-fledged doctor, and such a good doctor who think about helping people along with earning money. He also think about helping poor people, needy people. And remember, my friend, after having my MD in PSM from AIMS New Delhi, I was still not in love with PSM. But after my MD PSM, I went to the tribal area of Chhattisgarh to work there. I was working there in Jan Swasth Sahyog Chhattisgarh, GSS Chhattisgarh. This is in Ganyari village near to Bilaspur district, and 54 kilometers away from Bilaspur district, there are Achanak Mar Forest Reserve area. So now, when I worked in this GSS Chhattisgarh, I realized the power of PSM, how we can change the life of common people through PSM. And then I fall in love with PSM, and I am teaching PSM with the same love. And I hope you will also feel the love and passion, the power of PSM, how it can help transforming the life of many people. And there are many good stories which I learned there. If you are interested, someday we can discuss those interesting stories of tribal female unity, of tribal children, how they use Anganwadi to make all the children of their area healthy and fluffy. The adults are suffering from TB, but just with making Anganwadi better, they make all the children healthy, fluffy, so that in future TB will not be in those population. So this is the power of PSM. PSM can actually transform the whole country. It can transform the whole area if implemented well. And then after coming from there, I worked in Butterfly NGO. This Butterfly NGO is working for street children, because since my MBBS days, I wanted to do something to help these children who are on road, because they don't have any mistake, and they are just unlucky children, you know, and they are suffering from many issues. So I thought, why not dedicate my life to help the children? So I worked with Butterfly NGO. There was a Dr. Rita Panikar. You can listen to her TED talk also, with which I work in this NGO. And in JSS Chhattisgarh, there is Dr. Yogesh Jain and Dr. Raman Kataria, which were there. You can listen to his TED talk also. His TED talk is by the name Dr. 2.5. Dr. Yogesh Jain, one of my favorite teacher actually, he called himself Dr. 2.5. Why? This is a riddle. This is a hidden fact which you will know when you will listen to the TED talk. So these are some of the good doctors of India. Then I was talking about Dr. Raman Kataria, who was a surgeon, pediatric surgeon. And in that village hospital of JSS Chhattisgarh, he performed all kind of surgeries. And even AIMS New Delhi professor go there and perform the surgeries. So he's there to know. Then there is Dr. Saibal Jana, is a good person you should know. Then there is Dr. Punya Barto Gun, who is a revolutionary doctor in West Bengal. All the West Bengal Medical College student know him as their beloved senior, who help them whenever they have a issue in hostel, or whenever the government try to suppress them and all. He stand with them like a elder brother, and he is working since 1995 in slum areas of West Bengal, and helping the poor laborers to have their good health. So such good doctors are there, with whom I was lucky enough to work, and I realized how much powerful is PSM, how it can help in transforming our life. So I will be sharing with you all the stories which I learned while working with them, all the knowledge which I learned while working with them. And all these stories and knowledges will be given only to make the story interesting, so that you can remember those concepts till your exam, and you can do very well in exam also, prof exam also, plus you will do very good in future as a doctor also. So I hope you will enjoy this 5 day of You will enjoy this journey of PSM, which through which we will go in the next 1 year session. And these are some of the topics. I hope you realized that all these topics are also important and related with our life. So if you have any question or any doubt about PSM, feel free to ask it. Nikhil bro, give me this thing. Let me see if there is any question. Hello, Dr. Achal Chopra. Hello, Dr. Sambit Kumar Tripathi. Hello, Dr. Sobhi Khan. And Dr. Uzair Nawab has a question that, sir, I have one doubt that low fat and high fat diet 1000 kilocalorie and 1700 kilocalorie. Dr. Uzair Nawab is asking a question about high fat diet, which I discussed is 1000 kilocalorie. But now he is saying that, sir, there is also one diet which is low fat diet. What is that low fat diet he want to know? So, Dr. Uzair Nawab, you are a good question, very good. But your question hurt me. Actually, I don't know what is a low fat diet. I have read only about high fat diet and this data because it was asked in one of the INICT entrance exam of AIMS also. So I learned about high fat diet, but I don't know what is low fat diet and what is their calorie. So because Dr. Uzair has asked me, now I will read about it, and in our next day session I will discuss about it also. But till now I don't know. And being a teacher, I cannot guess. If I don't know, I will say I don't know. So that whatever information I give you is 100% authentic with evidence. Because if I give you one wrong answer, then all my answers will come under suspicion. That because I am giving wrong answer here, maybe I can give wrong answer in other place also. So I never speak anything which I don't know. I always say that I don't know, and not anyone cannot know everything. So I don't know everything in PSM. I am still learning, and many a time I learn from you, good student also. So I will learn about it, and we will discuss it in the next session. And tomorrow we will have our next session of malaria. We should know how to treat a patient of malaria, how to diagnose it, what to write in the prescription. And we will start with malaria, TB, and other such program, so that anyone who has started just right now in the third year also, in the first year also just joined, they can also understand it. And then we will enjoy the journey there. Okay. So thank you so much. Then there is a student who is saying that the chat option is not available in app. Yes, it is available in app. You have to go in the Sushruta batch group, join that, and then answer there. Or maybe when the YouTube and this thing session occur together, app session occur together, then because teacher can only see one chat, so they are giving me to look only on the YouTube chat. But only few 2-3 initial classes will go on YouTube. Rest all classes will be on the app only. So you can do the chatting on the app in those session very easily. And don't you worry at all if you find any problem like this or any other thing while my classes are going on. You found any technical problem also, you can always share with me. This is my WhatsApp number, you can directly share with me. And as I was saying, there is PW MedEd app which you have to download, and there will be this Sushruta batch which you will be joining. And in this Sushruta batch, all the classes, their chat you can put. Any doubt if you have, you can share it. And there is also a Telegram group, PW MedEd Sankalp or PW MedEd Telegram group. On this Telegram group also you can put your doubt and question, and I will be more than happy to help you there. So do connect with me whenever you have a doubt or question. I hope you enjoyed the class. And Dr. Hidden Medico is saying that, sir, you teach in a very good interactive manner. Thank you, dear. I just try to enjoy my own journey of teacher, because if I am enjoying teaching you, then I am sure you must be enjoying learning it. And the best way to enjoy your life is stop doing what you think is good to impress the society or people. अगर आपने अपनी दिल की सुनी और मन में जो बात आई है वो बोल दी सच्चाई के साथ, बिना कोई नौटंकी, बिना कोई उसके ऊपर कवर लगाए हुए, तो आपको भी मजा आएगा अपनी जिंदगी जीने में और सुनने वाले को भी मजा आएगा. So I'm just following the thing, same principle, that I will speak from my heart, less from my mind, more from my emotional part. And if I am speaking the emotional part, I am acting like my true self. And if I am my true self, I am enjoying it. So the other people will also enjoy it. So always remember, this is my one line secret to be happy in life. कि भाड़ में जाए दुनिया, हम बजाएं हारमोनिया, है ना? Let the world go into vain. Do not care about what other people are thinking. You play your own tune, है ना? And enjoy your life. Don't try to impress other, because if you are thinking what other are thinking about you, and they came to know that you are thinking what they are thinking, what they will think about you, that you keep thinking what they are thinking. समझ रहे हो ना मैं क्या कहना चाह रहा हूँ? कभी भी मत सोचो कि दुनिया क्या सोच रही है तुम्हारे बारे में, क्योंकि अगर दुनिया को पता चल गया कि तुम ये सोचते हो कि दुनिया क्या सोचती है, तो दुनिया क्या सोचेगी तुम्हारे बारे में कि तुम ये सोचते रहते हो कि दुनिया क्या सोच रही हो. पूरा इमेज खराब हो जाएगा. According to some of the leading psychologists, we waste 70% of our time, 70% of our thoughts are in a day just thinking what other are thinking. 70% of our thought is what other are thinking. दूसरे लोग क्या सोच रहे होंगे. And this is something which we can't change. What other are thinking, we can't change. We can only work on ourselves, we can only change us. And the person who is thinking what others are thinking, he will not behave in his natural form. He will become an artificial person who is living his life to make other happy. But your life purpose should be to make yourself happy, because only when you are happy, you can radiate the true happiness and smile and help other people. So my request to all of you is to be selfish. And by being selfish, I don't want you to be rude to other. But being selfish means try to make yourself happy first. Because if you are happy, you will radiate happiness and love. And other people around you will also be happy. So be selfish, focus on your own growth. Don't divert yourself with all this political news and bullshit thing, which are all faked and sold up. You need not to worry, because right now your focus should be on your own growth and enjoying your own journey. So just enjoy the journey. I hope you will enjoy the journey of PSM, and together we will rock this subject, make it easy and soft like ice cream, and enjoy it at the same time also like ice cream. Okay, so thank you so much for appreciation. That's what I wanted you to do in your life. Appreciate everyone around you, because everyone has some good quality in them. Try to see the good quality and appreciate them. So Dr. Hidden Medico was a person who just implemented what we were discussing, and it's that real science. You should appreciate your parents for sure, your friends, your girlfriend, boyfriend also, and most important, appreciate yourself, because we appreciate other and at the same time we are too hard on ourselves. We keep finding fault on us. Hey, you planned to study 4 hours, you only studied 1 hour. If you only studied for 1 hour, at least you studied now. Your plan will always be much more than what you will do in reality. So never be critics of yourself. Try to appreciate at least for 1 hour I was able to make my bum sit in one place and study, rather than complaining that why not 4 hours. You should appreciate at least 1 hour, because if you will appreciate, then next day your subconscious will be happy and will make you study for more. And if you criticize your subconscious, why not 4 hour, why not 4 hour, then next day it will become 0 hour. So always find good in other, but most important, find good in yourself, and always keep appreciating yourself and your own memory, and you will be a very happy person in your life if you are using this concept of positive deviance. And I try to learn more about it, and the more you will learn and apply this concept in your life, in your medical practice, in your personal relationship with your boyfriend, girlfriend, with your friend, the more happy will be your life, and the more money also you will earn. And so this is all about PSM. This is all about me, positive deviance. And this is the best hypothesis, best way of living the life. So thank you so much, all of your friend, for being here, for listening this session. And let's make our life and our journey in MBBS much more exciting and much more interesting. Let's fall in love with learning. That's the main goal why I am teaching, that how we can fall in love with learning. So let's fall in love with PSM together and let's rock it. Okay. So if you have any question, any doubt, feel free to ask it directly with me or on my chat, on the PW MedEd app also. Okay. Thank you so much. Hasta la vista, dasvidania. We will meet in our next session with malaria topic first, so that you should know that as a doctor, how to write the prescription, how to do the search of cases, and how to treat them well. Then we will move to other topics later on. Okay, so let me know if I can help you in any way. Thank you so much. Bye bye. Love you all. Thank you. Good night. Hasta la vista, dasvidania.